I'm Senyonjo Joseph from TASO Entebbe. I'm going to be speaking about strengthening community mechanism to improve mental health screening among adults living with HIV. It's a collaborative approach offered at TASO Entebbe, located in Uganda. We offer HIV services to over 2,200 older clients that suffer multi-heightened vulnerabilities to mental health. They have barriers to access to mental health, including weak referral systems, including low prioritization, hence making them vulnerable to mental health. We adopted a C2I approach that ran about 6 months from January 2024 to June 2024. And in this, we had a tested change known as the peer-led mental health integration model, where health workers and peers came together. They were taught about mental health and were embedded in clinics. Peers initiated the screening and referred clients to health workers for further, those that tested positive. They also, at community, started mental health kiosks that helped them increase accessibility to mental health screening, a model that worked for us. So from January, 17%, we rose to 95%, where 15% were diagnosed with depression and anxiety, and then linked to care. Qualitative analysis showed that there was increased engagement, reduced stigma to mental health. Conclusion, it is a scalable model that can be adopted in Africa and other parts of the world, especially in those that have limited resources. At TASO Entebbe, we are committed to show that we care about elder persons living with HIV, age with dignity, and mental health wellness. Thank you so much.